We now have another panel. If I can invite our next lot of panellists up, and then we'll be breaking for lunch after this panel. Can I invite Addie Wooten, who's the CEO of Smiling Mind, Carolyn Worth from Sikasa, Stephen O'Malley from Melbourne Fire Brigade, and Evelyn Gomo from the Employee Assistance Program. One of the things we wanted to focus on in this panel is self-care and how individuals who work in the kind of high risk, ever-changing, traumatic kind of fields that you all work in, what you can do to identify when you need a break, identify when you need help, get help, self-care, those kinds of things. So Carolyn, if you don't mind me saying, I know you're probably the most experienced on the panel. You've been in this field for a long time. How do you take care of yourself?
Oh, you're going to ask me about me. I was ready to talk about everybody else.
Gee, that sounds familiar, doesn't it?
What do I do? Look, I do all the obvious things. I take annual leave. I, make sure I sleep well, make sure I eat well. All the things you're told to do.
Have you always done those things though, or is this something you've learned to do?
No, I've probably always done those things. But what I also know from, there was an article in the paper one day, and then I looked up where it came from. It said that for every week you take off from work, you get 1 day of your blood pressure reduced or all the other symptoms gone. And I thought, well, that leaves a lot of the year left, really. So I started reading about not vicarious trauma, which I dislike completely because I think it's like a self-fulfilling prophecy, and read about vicarious resilience, which tells you, people are nodding, yes, it's such a nice idea. And it really does tell you to look at the small things that you can do, to feel really good about everything you do. Look at the small things your clients, patients, whatever you call them, can do to make improvements. So instead of expecting people to, change their life in the 6 months you see them or the 6 weeks, you make sure they do one little step and that they feel really good about that, and you do too, and that you tell other people as well as yourself. That was a really good thing that happened to them. Not that they haven't left someone and got a PhD or done anything else in the last month, but that they actually did manage to make one step towards improving their life, or they did leave.
So it's an achievable goal.
It's an achievable goal.
Yeah.
You said, look, I wrote down what you said. Here we are. You said, we must never forget how far we've come or we lose hope. I thought, that's right. And sometimes that's how far you've come. Yeah.
And that might be as far as you can go at the moment.
It may be, or ever. But that's fine. Right. That's fine. Yeah.
Oh, now I'm getting emotional, Karen. Can I ask the same question to all our panel? So starting with you, and I'm actually deliberately asking for you to share that with us, because I think one of the things that we do as professionals is have that us and them kind of barrier, and we all need to be vulnerable as well. So you don't have to disclose whatever you don't want to disclose, but what do you do to take care of yourself working in this field?
I feel like a bit of an outsider. I'm from Smiling Mind, and I get to work in a very positive environment, but I have spent a lot of my career in hospitals. So, and it's interesting actually to step out of hospital world and into a different environment. You realise all of those small things that perhaps you don't acknowledge in terms of looking after yourself. For me, how do I look after myself? I have to say meditation, because that's what I do for a living. So for me, mindfulness and meditation is really important. And
so Smiling Mind, just to go back, is completely dedicated pretty much to mindfulness and meditation. I have the app on my phone.
Great.
It's free. I don't use it a lot, but I use it as much as I can. I try. That's where I am. It's there. Right. So it's dedicated to trying to improve wellbeing through mindfulness and meditation.
Exactly.
Yeah.
So, Smiling Mind's a not-for-profit. We're based here in Melbourne, and we were started with a view to try and connect young people to the idea of mindfulness and meditation. And the feedback we got was actually that, adults could benefit from this as well. And this was before all of the meditation apps emerged into the App Store. We're really passionate about making mindfulness as accessible as possible. So for me, using mindfulness for myself doesn't necessarily mean that I take an hour a day to meditate, because sometimes that's completely unrealistic. But I find those small moments where I can acknowledge the small things, or even just take a moment to breathe, because that's all I can fit in for my day. So it's noticing the small things for sure.
In fact, one of your apps, and I know this, goes for 3 minutes. And I thought to myself, because you know when someone says, oh, you should do like hot yoga and it goes for 90 minutes. I think if I had 90 minutes, there's a lot more things I'd do than hot yoga. But I can't actually excuse not doing 3 minutes.
Yeah, we can all find
I can find 3 minutes. Yeah, fantastic. And Evelyn, so what do you think in terms of self-care? What do you do?
Yep, so 100% just following on from...
Let me just make sure your microphone's on. Can we hear Evelyn? We can? Great.
100% trying to practice what I preach. And self-care and wellbeing, they're terms that are bandied around, but I think it often really just comes back to basics, to this next breath, to really focusing on this next breath, having it be deep and release whatever you need to release in this particular moment, but also the real basics of eating, sleeping, exercising, hydrating, the really simple things that we often forget to do, particularly when we're caring for others. And I think...
Have you always been good at these things?
I've been so not good at it.
Great.
So,
Great.
And I have to
Tell
confess...
me more.
I have to confess that for the first 12 months that I tried to meditate, all I did was fall asleep, which maybe was what I needed to do. So it's taken me a long time before I can actually take it on board and have it be of benefit. But I think it's really important to acknowledge that there are certain things that work for some people and other things that work for others. And just permission to look after yourself is what I talk about all of the time. And certainly in our workplace, we do a lot of talking and connecting and debriefing. And we do talk about vicarious trauma. I love the term vicarious resilience, but I think particularly in healthcare settings, it is not a matter of if I'm going to be affected, it is when I'm going to be affected.
And suck it up's not good enough.
Yeah, so from an employee assistance perspective, employee assistance program also stands for the acronym of early intervention, awareness and prevention. Let's keep talking about that, because the more we talk about it, the more we normalise it.
And I asked you for a very specific reason about I was happy in a way that you hadn't been doing this your whole working life, because we were actually I was talking to a couple of the people from the women's before, and we were joking about, eating the sugar that was out there, and we're like, oh, well, I used to smoke and I don't smoke now, and I used to drink too much and I don't drink now, and I used to, whatever we used to do. Most of us will have something that we use as a coping mechanism or have used, so we get better.
Absolutely. And I think I grew up in a generation of nurturing and looking after others being the most important thing. And I think that notion of looking after ourselves is what we often, really, really forget about. So I think that's absolutely vital.
So Stephen, obviously in as being a fiery, you're around trauma and you're familiar with the concept of vicarious trauma. Being that you're the dude on the panel, I'm going to give you the dude question. How is it different trying to talk to men about self-care?
Yes, it is actually, Nellie.
Yeah.
It's a lot different.
How's it different?
I was thinking the other day that there's only one thing I've done longer than being a firefighter, and that's actually been upright and breathing. I've been a firefighter for 30 years now, so I haven't done anything else for longer than that period of time. So I know the culture really well. I know the male-dominated nature of the culture and of the workplace. It is really hard. Look, we've got mechanisms in place to handle our self-care in an operational capacity. Not just that. So if people are having issues with family problems and so forth, they can actually access our employee support programs as well. We promote wellness checks quite often. Our health and safety department is a behemoth. We've increased our peer support or peer contact officers by, I think, double since the review at the end of 2016. So if I could say we've got more peer contact officers than we do female firefighters. So we've got about 75, I think, or 80 peer support contact people. So just to put that in perspective to how many female staff we have, and we've got, which is about 3.5%. So I spend a lot of my time, I gravitate away from my culture and I found a lot of solace in women's health, and that's who I partner with, and that's why I met you originally. It was through the work Women's Health have done looking at the emergency management sector and how, we do suffer adversely based on the stereotypes that we project. So a lot of my work's done in regards to gender inclusion. It was cultural inclusion as well. My now title is Fairness and Inclusion Officer at the MFB, which, can't be hard, surely. So it is a challenge. I mean, I find that, there's been comments about how this has to be leadership driven, and I know that I get more bang for the buck, so to speak, when I speak to people at younger fireys who actually have a more contemporary view of the world, and rather than the deadwood. I'm not saying all the seniority are deadwood, they're not.
Someone tweet that.
So
let's see what happens.
Surely that's a term we use fairly liberally at work. I think it is, yeah. So, and I get a lot out of speaking to the younger ones, the ones that come in with fresher ideas and a more contemporary view, and then more cognizant
young people
with the
more
language.
open to change. What?
Yeah.
Yeah,
so it's tough.
But I think it's interesting, and I'll come back down the panel as well. In your case, you're in a job that by definition involves high stakes trauma in terms of the literal fire. But you're also in a profession where you are one of the founders of the Women in Australasian Firefighting, whatever it is, that thing. Yep. You're trying to work toward gender equity. You're in a resistant culture, frankly. You're in a place where you don't fit. So you've got the double whammy. How do you take care of you? How can we model what you do? Or be honest, are you not?
Oh, look, I have small wins quite often. They are small wins, but to me they're significant. In the scheme of things, they're quite small. This is another small win for me being here today. So thanks, Rosie, for the invitation. But and others, the other wins are pretty much what we're talking about here today. So it's exposing people into our sector who ordinarily wouldn't have a voice in our sector. So it's the likes of Liz Broderick back in the day, and David Morrison couldn't be there, but Angus Houston was there at the same time at a conference. Mary Barry and Gerald Rector last year. So I've been able to secure a keynote presentation at an emergency management conference that deals specifically with, they don't know it yet, but it deals specifically with culture change and how we can demasculinise, if that's a word, our culture. So it's strategic on my part. It's hard. I hear murmurings around the corridors at some of these conferences saying, I've got to apologise for being a man today because there's a feminist or there's a powerful woman there speaking, basically about culture. And Julia Gillard was a keynote this year, and Martina Jewell, who's a very decorated...
Oh, I thought you were saying you heard that today. I was going to say, really? You mean at the Fireys...
at the conference, emergency management conference. So we changed what it looks like. We're trying to strip away the masculine facade and put up one that's more, once again, contemporary and more accepted.
So it sounds to me like you're doing two things: taking a little or big win where it is and acknowledging it as a win.
Yeah.
And then when you're needing to be around your people, I'll only say that these are your people. That's kind of fortifying.
Yeah, it is. It
fills
really
you
is.
back up.
Yeah, it does. Yeah, because I can celebrate it here where I can't. It's hard for me to celebrate it back at work.
I can't imagine walking into a fire station and going, let's talk about mindfulness. I mean, I hope it happens.
Yeah.
I hope it happens, but it must be difficult. Yeah.
Yeah.
All right. Did I pick up on that? Yeah.
Fireys that practice mindfulness regularly. I've had very good conversations with them. So it is, but it seems to be more individual rather than systemic.
Yeah, it is.
Yeah, it's a bit hidden.
So one of the things we've heard about today, and anyone who works in this area will know, even though we try and get back into, yes, progress is happening and positive things are happening, you can also be overwhelmed with the enormity of the task. How can mindfulness, meditation, the things that Smiling Mind is about, how can that help?
Great question. So I think maybe thinking about my working definition of mindfulness is about learning how to be aware of yourself and be aware of your surroundings. So it's living in the present moment rather than getting carried away with whatever's going on in your mind.
Does that, because again, I'm just trying to come back to basics if you're not already there, being aware of yourself, does that mean going, okay, I'm sitting with this patient, client, whatever terminology you want to use, and I'm feeling unsettled?
Yeah.
Or I'm feeling scared, or I'm actually feeling the thing?
Yeah, absolutely. And obviously, you have to do that in a safe way. But I think what happens to a lot of us, and certainly I've experienced this before, is that an emotion wells up and you get carried away with it and you don't even really realise what's happening. So you might find that your line of questioning changes with the client or the patient that you're working with, or that you start to go down a tangent that you didn't plan to go down, or you feel like you're losing control in that scenario. And so the simple fact of noticing or paying attention and even acknowledging how you're feeling, even if it literally takes you a second to tune into yourself and think, I'm feeling unsafe here, or I'm feeling overwhelmed by this story that I'm listening to, the simple acknowledgement of that feeling can actually change or diffuse the feeling. And then that gives you a little bit more power to choose what to do about it. So in that next step, you can decide, do I continue to have this conversation, or do I actually change the scenario that I'm in?
And that takes practice.
It takes
doesn't it? You don't just sort of hear about that and then start doing it.
No, exactly.
It's like a muscle.
It's like a muscle, exactly. You have to practice it, and it takes time to build. But you can practice it in pretty simple ways. So, whatever you do in your day, you can actually start to tune in and ask yourself, how are you going right now? Right now, sitting here, if you tune in and ask yourself, how are you going? You'll learn something probably that you're not aware of right now, because we spend a lot of our time in our heads and not in our bodies.
Carolyn, do you think, watching, I'm disclosing more than I should, but I will. I used to work in family violence before I started in comedy and homelessness, and frankly, the reason I had to leave is because I got burnt out very quickly. And I think fundamentally I wasn't at the right age, or maybe even personality or temperament to do the work. Do you think that I was, the open wound kind of scenario. Do you think that there are personalities that are not suited to the work?
I actually do. I do think some people shouldn't do the work. We keep staff.
How do you know that?
Oh, that's a very good question. But look, we've kept staff for a long while. I've been there 26 years. We have very few people leave. We've never had a work cover case. However, occasionally somebody comes and I think, really, you're going to find this difficult. And it's almost like they're very, very intense about it. It's terribly important. Everything's a disaster and a drama, and they don't see any little things that are a good thing. So it's just terrible. I have this awful line I used to say, do you live in Kabul? Are you going home to Kabul? And they say, what's that got to do with it? I'd say, well, you're going home to a nice house. You're going home to, I hope, a reasonable relationship. You've got terrific kids. You've got a dog or a cat. Talk to them. All those sorts of things. And if they actually think I was quite crazy, I think, you're going to have trouble with this. And sure enough, they leave very quickly. So you either stay at Seacasa or you leave quickly. And you leave quickly because it doesn't sit for you. You can't leave it at home.
Can you grow out of that, do you think?
Probably if you put a bit like mindfulness and meditation, if you put some time into it. Some people get very good at mindfulness and meditation. Others just think, no, I can never settle enough, and they won't do it. So, yes, I'm sure you can train yourself to do it.
You're looking very intensely at me when you say that, Carolyn.
Was it personal?
And you'd be right. No, I think, it's an interesting question about whether, because you wonder, Evelyn, do you sometimes just come across someone working in this area where you just think, actually, it doesn't make you a terrible person, but you're just not suited to this work. You're not going to be healthy in this line of work.
Yeah.
How do you tell someone that?
So I think we need to really be thinking about how to normalise the messages, particularly that we give to managers and leaders in organisations, and that is what changing culture is all about. And because I come from the EAP perspective and family, it is about really thinking as organisations, how do we partner best with our EAP organisations so that our managers and leaders are involved and engaged in help-seeking behaviours and encouraging health-seeking behaviours from an early perspective, but also, really importantly, in answer to your question, having the capacity and courage to say to yourself, am I the right person to be having this conversation? Am I the right person to be involved in this scenario, whatever this scenario is, whether it's with someone on your team, whether it's with a patient, whether it's managing upwards? Should this be me, or should I be getting support elsewhere? And that's where that partnership can be so, so important, because when you're utilising a good EAP partnership, you're partnering with someone, with an organisation outside of your organisation. So you're really getting that professional, objective, non-conditional support, and where you're allowed to say, I don't feel okay about how I'm feeling, I don't feel okay about this piece of work that I need to do, or how I did it, or where this has led me. And I just think
I might not even know why, but
absolutely,
I don't. Yeah.
Absolutely. And I think also, you know, there's been a notion within our healthcare system for such a long time that we just need to build a bridge and get over it and get on to the next thing. And I just think that is not possible. We are humans. We need to acknowledge the impact that things at work have upon us. We need to acknowledge the fact that often it's outside of work that things show their ugly face as well, and being able to marry those, being able to marry your heart and your head, being able to really incorporate that with who you are at work and who you are at home. And like I said, EAP, I feel like I'm plugging too much, but I will really continue to do that, because I think you just have, it's a gem of a partnership and can really assist all organisations, not just health organisations, but a good partnership works really well.
And Stephen, so I presume when you recruit for the fireys, there are various tests that you go through. You know, can you run this far? Can you jump this high? Do you also do, I don't know if psychological testing is the right word, but do you ask questions about whether people are going to be able to be emotionally resilient enough to do the work?
They do psychometric testing. We don't test very well at any level throughout the organisation on emotional intelligence at all. So it's kind of, and they'll dismiss it as being, you know, soft skills as opposed to really important people skills. Not necessarily. Look, I prefer not to talk too much about the recruit process, and I get a little, I've got to contain myself a little bit, I suppose, but when government say that we need 400 more female firefighters, and that's a mechanism to enact some culture change in the organisations, because we know that there's a review pending. There's been other reviews as well that have been dismissed and, you know, just swept under the carpet. So I'm hearing that will change our culture, but there's a kicker there in saying that dispels one of these 4 determinants of gendered violence. If we start showing that to be a firefighter, you don't have to be a big, strong, masculine, you know, tough guy, you know, regardless of what the entry requirements are. We know that we've got female firefighters, so we know the female can be a firefighter. So 400, what's the upside, the absolute upside of having 400 more than we have now is that it's going to change the culture. And that gendered stereotype, the thing that keeps them getting, we sell entry into the job with that hyper-masculine image as well. I mean, most of the work we do isn't necessarily holding a hose on a fire. It's emergency medical support. So it's assisting the ambulance in what they do.
The soft skills.
And they've got more than parity, I think, or at least parity with their staff. So
also, in the context of this discussion, it occurs to me, anyone who's at the forefront of culture change has a hard time. You know, so those 400 women need to be very, very carefully looked after.
Yeah,
it's not their job to change the culture.
Yeah, and I know that that it won't happen in my lifetime anyway. I don't think. I mean, we've got 70 odd, say, with all due respect, in the MFB after 128 years. So I'm not sure how we'll go before 2021. So it's a challenge, and it has to be done the right way. And I sit on the board of a
Have you given yourself to 2021?
No, I didn't. The government has. of an Australasian female firefighter collective.
Yeah.
And we talk about this all the time, yet no one's spoken to us or contacted us to take a temperature reading on what the rest of the country actually feels about this. And internationally as well, because we're really closely connected internationally, and there are best practice models out there that actually are in double-figure percents of inclusion. And
so is it a case then of we actually know what to do, we don't like the answer?
More or less, it's the culture sort of, and I say this to a few people, is that if they don't know, they don't ask. And in a ranked, structured organisation like ours, be careful, if they don't know at the very top, they tend not to ask down. They'll just try to find out in another way. So it's like a quick learn type thing. It's like they'll Google it rather than ask. So for want of a better word, I could be seen as a subject matter expert on family violence, which is no big thing at the MFB because that's not our core business. But do you think that there's a continuous discourse about it? No. But I know that we know the stats. We know that more women are killed in intimate partner violence than die in house fires. We also know that fire is used to destroy evidence and to kill people as well. Yet that doesn't get flagged and we're risk cognizant. We think about risk as that's our core business, is looking at risk.
And I have to say, just because it's caught me out the side of my eye, shout out to the person doing self-care by knitting over there. Can you hold it up for us? How much have you done? Hello. How cool is that? See, that would be my form of meditation because I'd actually have to do something at the same time. So nice one. Okay, we could go forever, but I want to give you time for questions. So again, hands straight up. If you want to ask our panellists anything, go. We'll just wait for the microphone. Thank you.
I'm just wondering if the MFB are doing anything about calling out calling out men who are speaking inappropriately about the way they treat their women.
So do you mean in terms of sexism and jokes and stuff, or violence specifically,
like
gender
all the
equity stuff?
They've just started putting on TV.
Steve, what's happening?
It's really hard. I mean, there's a sense that I look at it from a certain perspective, and I know that there's the Veriok review that hasn't been released yet, and I know that the behaviour in our...
Does everyone know what the Veriok review is? Can you just explain what that is?
The Victorian Equal Opportunity Human Rights Commission were commissioned by the government to review the culture of the organisations. And for what it's worth, we didn't have these disgraceful moments that other fire services have had. For whatever reason, we haven't had that spy camera put into a change room or a Facebook page set up as to which, rating female firefighters and stuff like that. So, look, the culture does surround itself, and it would deny that there's any sort of, overt bad behaviour. And I know, speaking to the female firefighters that I know at my workplace, that they tend to say there's nothing to look at here or nothing to see here. I might beg to differ, knowing what I know, but and knowing what men are like when there's groupthink going on and when they're in a culture like it is. But as far as if there's anything officially in place, well, we've got workplace behaviour policies and we've got codes of conduct, public service codes of conduct, and so forth. But I still think we've got a long way to go. And
just picking up on that, there's incredible pressure if you're in a minority of women, as you are in comedy as well. There's an incredible amount of pressure on you to call that out all the time. You become the one that no one wants at the gig. Or that I can understand why female firefighters, whether they're self-editing or for whatever reason, are going to say there's nothing to see here, and you understand that too. Other questions? Yep, up the back there.
I'm going to go with you again. You just mentioned your wellness checks earlier on. Just wondering what that looks like for you.
For me, it doesn't look like much at all. I've been off the trucks for about 10 years now, so I've immersed myself into the sort of social justice sort of side of things. So those risks inherent with responding to alarm don't really... Although, invariably, I'd never been to an emergency call where there wasn't a member of the public on scene. I mean, someone's called 000. So someone else is exposed to that scenario, whatever it is, before we actually get there. And it's our business. That's what we do. That's what we get paid for. The wellness checks, they are. Look, there's being a family as it is, and they do surround themselves, a few fireys got together. There were 4 suicides in quick succession a couple of years ago, with all due respect. I'm not 100% sure what the date was, but and they've released an app just recently, which is Let Me Know, I think the acronyms, I have to get that right, LMK, yeah. So, and it's not so much an app as it is a website. So what that is, it's fireys encouraging other fireys to speak up. So the age-old issue about us not seeking help is it gets reinforced in our career staff. It's reinforced in volunteer staff that you have to be stoic, you have to not speak out. But when there are a pretty user-friendly people who are running the wellness checks in our health and safety departments, it makes it so much more easy for people to approach them to actually just have a chat about their state. People tell me all the time I should get wellness checks, and I just don't. I go home and do a wellness check in the mirror every day. That's all right. Yeah, he'll be right.
That sounds
okay.
well researched and
thank you.
effective. So, Evelyn, one of the things that I've noticed doing health promotion gigs, one of the things that I loved seeing is where organisations do wellness checks for their employees, and there will be, I don't know, your blood pressure and, what are you eating and how far can you run, whatever. The things, I don't know, what do you test? But as part of that, we'll then start to ask questions similar to what we heard before. Are you frightened of anyone, or the kinds of things that you'd word appropriately? Is it an effective way to get these kinds of questions in almost by stealth, less confronting, to kind of go, basically we're checking on how you are and how your mental health is as part of a wellness check? Do you think that's an effective method?
Absolutely. And I think any way that we can normalise any version of an "Are you okay?" question,
Absolutely.
That's a good version. And, we encourage people over and over again, start a conversation. It doesn't have to be big, it doesn't have to be huge. Start a conversation, have it again, start another one, keep going with it. And often it's the smallest start that leads to somebody somewhere feeling safe enough to say, you know what, I'm actually not okay, and thank you for asking. And then there is so much support that can be offered. But if we're too scared to start that conversation, so whichever way we can start that conversation, that is a good way.
Well, and if we didn't even know, I mean, and I've heard Rosie say it before, we have a stereotype, particularly of family violence, that you must have, a broken cheek and a black eye. Perhaps if you're asked, does someone control your money?
Absolutely.
Do you have control over your paycheck?
Yeah.
That might be the first time
Yeah.
that you've ever considered that you're being controlled.
And sometimes it's even asking, what should I be asking you that I haven't asked you?
Yeah.
Help me understand, because you might think that you've got all the right questions, but you still might not be hitting the mark. And really engaging the person, I think, is what it's all about. And that's why I say ask it again and ask it again, and think about a different way of asking it. And don't be embarrassed or ashamed to ask for help, because the only way to debunk all of the stigma around you should be an expert, you should know all of the answers, is engaging in those help-seeking behaviours.
Absolutely. Other questions? Yep. Sorry?
Just wanted to know, I come from a small country hospital, and some of the barriers that we would come up against is everyone's related to everybody. Everyone knows everybody, so with disclosures and asking those questions, you might be asking the question of, your manager's wife, or, there's some barriers that we come across in the country areas.
Can be your kid's footy coach that could be the perpetrator, or
Everyone knows everybody.
Yeah. So, I mean, I'm from a small town. Is anyone else from a small town? How do we get around Carolyn, how do we, first of all, deal with the safety issues involved in that?
I think that's always a problem, small towns. It's a problem for small communities too. There are a number of small communities. Always an issue, especially if you need an interpreter, because you're really worried it's your cousin, or they're going to at least say, I saw so-and-so the other day, and it becomes obvious they had to see you at work. I think you can use phone lines to do it. We can make it really clear in institutions, organisations, that breach of confidentiality is taken really seriously, so you don't go home and have a bit of a chat to your partner about who you ran into today. But it is a problem. I think that's always been a problem in tight communities.
So that could be rural and regional community, it could be a religious community, it could be any small community where people are connected.
That's exactly right,
Yeah.
Yeah.
How do you deal with it? Like at your organisation, I mean, is it clear that you can't talk outside of work, for example, or would...
We've just had with all of our staff meeting, I'm only new to this role in about the last month, but we've just had a privacy and confidentiality policy being addressed at all staff meetings across the organisation to reiterate, disclosure of any information, because you would get examples where, like you said before, is Nellie at work today, and you know that person. No, she's not at work today. So just reiterating that with all department heads, and so everyone's on board. But in a country town, it's hard because everyone does know people, and people probably wouldn't disclose freely because they know that you know that person, or that the perpetrator works there and you're not aware of it, or they're just barriers.
You'd be worried about the consequences, wouldn't you, of telling your manager who might know your sisters.
They grew up with them, they went to school with them, they're related, so.
Well, and are there, if there aren't actual clear consequences, Evelyn, do you think, for example, if you breach of privacy in that particular situation, should someone be sacked, for example, for a breach of privacy?
That's such a big question.
Can I say yes?
No. It's probably not. I probably can't answer that question right here and right now. But I think that we just need to keep educating around confidentiality. And I always advise, we do quite a lot of work in rural areas. I always advise partnering with other organisations where it's outside of your town, even if it's in the next town or the next town along, or it's a larger organisation somewhere else that you can partner with and get that kind of assistance. But
someone outside the community.
Yeah, absolutely. In a different community or in a different organisation or in a different health, in a different hospital somewhere else where, and I think using the telephone or the computer is a really, really good way of being able to confidentially access support, but we definitely need to keep talking about confidentiality, and it is almost impossible in a small rural space not to know who you're going to bump into in the supermarket, and have a really genuine understanding of how that might impact somebody. So it is about continued conversations again, and certainly education around what confidentiality looks like and how it's impacting.
And it occurs to me as well, in that context and the amount of things we see on the news, particularly where there's been, at the very serious end, murders in country towns, and the thing that you hear over and over, he was such a nice guy, he was such a family man, he was such a good guy. It's a very different context, isn't it? That happens in the city as well, but where you might be disclosing to someone who will say, but he's such a nice guy. So how can we put things in? Is that just a matter of education, Carolyn, do you think?
I actually think it is, and you probably need a campaign like they had in England in the war, which was loose lips sink ships. Now, I'm not quite that old, but I can remember
that it's life and death.
Yeah, that it's life and death. So I think probably we should have a campaign around this about, chatting to your friend or whoever could get somebody hurt. And we haven't had a campaign like that. We just talk about it as a policy, and your question, could you get sacked, So it would be worth doing something like that.
I think the flip side of that's really important as well, because we don't want to close people's mouths. So it's really getting that balance between what's appropriate to talk about and what's not appropriate to talk about. And one of the things that our organisation has been doing a lot of in certainly the last 12 months is sending people from other areas to small towns so that it can be a completely objective person who's coming to have conversations, teach, educate, and it doesn't go out of that space.
Absolutely. It reminds me of my 11-year-old daughter came to me the other day talking about, you know, when you hit that age between what's the difference between saying, well, this friend's doing something that upsets me and quote unquote bitching, you know, or gossiping. And there can be a very fine line, but I don't know that all of us have got that sorted out. To be.
And I think the other truth is that we like to gossip, unfortunately. And so that office gossip that happens is part of that education process. And that's what I mean when I say what's appropriate to talk about and what's not. What does respect at work look like, and how are we teaching that, and how are we enhancing that? Absolutely.
Which is probably the difference between encouraging people to talk to someone about what's happening to them, but you talking to somebody else about what happened to them. That's gossiping, isn't it? Not encouraging people to be open.
And a very different thing if you're disclosed to and you ring up Sikasa and say, someone told me something and I don't know what to do with it. That's very different to, oh my God, at the barbecue, can you believe this? That's a completely different.
That's different. That's
all right, we're going to have to...
One comment?
Yes, you can,
would be remiss if I didn't mention, I wonder where we'd be without the research that was done post-Black Saturday. So I'm talking about our sector, and you MC the conferences in 2012 and 13. So the first was looking at hidden disasters, which was domestic violence post that natural disaster. And the second, because it came across pretty quickly in the piece that this is also about men. Absolutely was, because the self-harm and suicide that was happening in those bushfire-affected areas was palpable, and it was because they didn't. So the theme around that second conference was just us, because most of the men, if not all of the men that were spoken to by the researchers, the late Claire Zara and Deb Parkinson, they had no voice. Or the women didn't have a voice firstly, but then the men felt they didn't have a voice as well because they were adhering to the stereotype. And they had no one to speak to. Can I just give some, because I think it's so critical and it's actually relevant to your sector as well, to give some context, because I don't know if everyone, you know, is aware of that research, but post any disaster, whether it's fire, flood, earthquake, whatever, family violence spikes dramatically. Male suicide also spikes dramatically, and yet we do not have warnings about our current model of masculinity and how it affects violence to women and violence to the self when we come to bushfire season. Why is this not happening? I mean, I'm looking at you, Steve. I know you want to do that. I've got a training package here, Delly, if you really want me to talk about the training package. And we have been training it. So one of the outcomes from the task force that was set up post that event, and post the research rather, was guidelines into gender and disaster, gender and emergency management more broadly, including a checklist on your organisation, like how you do gender inclusion, on how you are a welcoming workplace or not. And the training packages are really important as well. So the 4 packages we've morphed into one that I facilitate and can't remember the name of. It's Gendered Violence and Lessons in Disaster Session. And it's because we've changed the name of it. And the feedback has been, when we delivered it in Tassie just recently, was overwhelmingly positive. And the self sort of reflection amongst these hardcore arms folded, feet on the seat sort of fireys that were in these sessions, the way they changed at the end, and looking at their feedback, looking at their written feedback at the end of it was really rewarding.
And imagine a situation, and as someone who does a bit of media stuff, I take my part of responsibility in this. Imagine it's coming into bushfire season, and what we were hearing is hospitals, you're going to have more incidents of domestic violence to deal with. The police are going to have a spike in calls. You need to look at, perpetrators as well as victim survivors, and this is going to happen. We're not guessing. We know this is going to happen. Yeah. So we need to change that conversation.
Yeah, absolutely.
Yeah.